Welcome to the We Level Up Treatment Center video series. In today's video we will discuss: can you drink on ibuprofen? While mixing alcohol and ibuprofen occasionally is usually harmless, making it a habit can harm your stomach and kidneys. That's why it is generally not recommended to mix alcohol and ibuprofen due to potential adverse side effects. Consuming alcohol while taking ibuprofen increases your risk of developing stomach ulcers or internal bleeding, impairing your liver's ability to process toxins. Taking ibuprofen with a high blood alcohol concentration increases the time it takes for the body to metabolize both substances, potentially leading to an overdose. Therefore, if you consider drinking on ibuprofen, you should limit consumption and consult a medical professional before combining alcohol and ibuprofen. Remember your health before reaching for an alcohol and ibuprofen combo. What is ibuprofen? Taking ibuprofen relieves pain, swelling, and fever. Ibuprofen is a powerful nonsteroidal anti-inflammatory drug available under brand names like Advil, Midol, and Motrin. You can buy it without a physician's prescription, but don't let convenience jeopardize your safety. Ibuprofen is a strong medication with possible side effects that can be harmful if not taken correctly. Avoid alcohol and ibuprofen risks by using the drug as directed and avoiding alcohol with ibuprofen. Alcohol and ibuprofen interaction. Is it safe to take ibuprofen with alcohol? When it comes to mixing alcohol and ibuprofen, moderation is key. While a single glass of wine or beer rarely has significant side effects on its own, combining frequent alcohol and ibuprofen use can heighten grave risks like digestive tract irritation, bleeding from ulcers in the gut lining, kidney pressure for those with existing conditions such as liver, kidney disease, high blood pressure. Dehydration due to alcohol also increases these health complications. Drinking alcohol with ibuprofen makes it harder for kidneys to filter toxins properly. So, don't consume too many drinks if you're drinking alcohol with ibuprofen. Can you mix alcohol and ibuprofen? Ibuprofen is a common pain reliever available over the counter and is often used to treat headaches, menstrual cramps, and other mild to moderate pain. Alcohol is a lawful and widely purchased substance often enjoyed in social settings. While both substances are generally safe when used separately and as directed, mixing ibuprofen and alcohol can have potentially dangerous consequences. Ibuprofen and alcohol interactions dangers. Mixing ibuprofen and alcohol can lead to several potential interactions and negative health consequences, including gastrointestinal, GI, bleeding. Both alcohol and ibuprofen can upset the lining of the gut and intestines and cause indigestion and vomiting. Indigestion and vomiting. Alcohol is known to boost the production of stomach acid, which aggravates the stomach's sensitive lining and leads to symptoms such as nausea and vomiting. Drinking alcohol on an empty stomach can further exacerbate this effect, making it more likely for individuals to experience stomach upset. Gastric ulcers. Constant irritation can lead to ulcers and bleeding. When consumed together, alcohol and ibuprofen can increase the risk of GI bleeding. Kidney damage. Both ibuprofen and alcohol can be hard on the kidneys, and when used together, they can raise the chance of kidney damage or functional impairment. Increased risk of blood pressure issues leading to stroke or heart attacks. Alcohol can increase blood pressure, and ibuprofen could reduce the blood pressure lowering effects of certain blood pressure medications leading to heart problems. Impaired liver function. Both ibuprofen and alcohol are processed by the liver. They can raise the chance of liver damage or functional impairment when mixed. Drowsiness leading to increased risks of accidents or injuries. Both ibuprofen and alcohol can impair cognitive and motor functions, making it more likely for individuals to have accidents and potentially injure themselves or others. The effects of mixing ibuprofen and alcohol can deviate based on factors like the amount of alcohol consumed, the dosage of ibuprofen, and an individual's overall health condition. In addition to the risks listed above, other potential interactions and side effects of combining ibuprofen and alcohol may include increased risk of dehydration. Both alcohol and ibuprofen can cause dehydration, and when consumed together, they can usher in a greater chance of dehydration and associated health problems. Interaction with medications. Ibuprofen and alcohol can interact with other medications, including blood thinners or certain antibiotics, potentially leading to negative health consequences. Negative impact on mood and behavior. Alcohol and ibuprofen can affect mood, and when consumed together, they can lead to increased irritability, mood swings, and behavioral changes. Impaired memory and cognition. Even when taken alone, alcohol and ibuprofen can impair cognitive function and memory recall. When used together, they can heighten the effects of this impairment, potentially leading to memory loss or confusion. It's always best to consult with a healthcare provider before using ibuprofen or alcohol, especially if you have any underlying medical conditions or are taking other medications. If you suspect experiencing adverse effects or interactions from mixing ibuprofen and alcohol, seeking medical attention directly is vital. Follow safe and responsible usage guidelines when taking medication. Avoid consuming excessive amounts of alcohol and ibuprofen or taking more than the recommended dose of medication. If you have any questions or concerns about mixing alcohol and ibuprofen, you should talk to your healthcare provider. Will ibuprofen and alcohol kill you? It is generally not recommended to mix ibuprofen and alcohol as it can increase the risk of negative side effects and potentially harm your health. While mixing ibuprofen and alcohol can result in serious health concerns, such as liver damage or bleeding, it is not likely to cause immediate death. However, it's always best to avoid consuming excessive amounts of alcohol and to follow safe and responsible usage guidelines when taking medication. If you have any questions or concerns about mixing alcohol and medication, you should talk to your healthcare provider. Both alcohol and ibuprofen can lead to gastrointestinal, GI, bleeding, and when used together, they can increase the risk of bleeding even more. Alcohol can also increase the body's stomach acid production, exacerbating the risk of GI bleeding. In some cases, using ibuprofen while consuming alcohol can also conceal the consequences of alcohol, leading to an increased risk of alcohol poisoning. How long after taking ibuprofen can you drink alcohol? Ibuprofen and alcohol. How long to wait? Ibuprofen is quickly absorbed and eliminated from your body, requiring a minimum of 10 hours for the drug to be cleared out before it's safe to indulge in an alcoholic beverage. So if you don't want unwelcome side effects like headaches or nausea, keep this advice. Wait at least 10 hours after taking ibuprofen before raising your glass. Can you drink alcohol with ibuprofen? Can you mix ibuprofen with alcohol? In addition to the physical risks, combining ibuprofen and alcohol can lead to impaired judgment and coordination, raising the chance of mishaps and injuries. It is important to note that these risks apply not only to those who consume alcohol regularly but also to occasional drinkers. Even 1 or 2 drinks combined with ibuprofen can increase the risk of complications. In conclusion, while ibuprofen and alcohol are generally safe when used as directed, combining the two can have serious and potentially dangerous consequences. If you are experiencing pain and need to take ibuprofen, avoid drinking. If you do decide to drink alcohol, it is best to avoid taking ibuprofen or to take it at a separate time to reduce the risk of complications. Always consult your healthcare provider before mixing alcohol with ibuprofen or other medication. At the We Level Up Treatment Centers Network, we understand that addressing both issues is essential for successful inpatient treatment. Our dual diagnosis treatment plan encompasses physical withdrawal, psychological factors, and managing underlying mental health disorders. Our specialized mental health analysis helps to identify possibilities for treatment in collaboration with mental health counselors and medical providers. Treatment includes access to behavioral therapy and medication treatment. We recognize that substance abuse and mental health disorders can influence others and result in a vicious cycle of addiction. We aim to provide excellent recovery services to promote improved healing and long-lasting recovery. If you suspect you have a mental illness alongside addiction, seeking help at a qualified treatment center is vital. At We Level Up Treatment Centers, our trained medical professionals use a comprehensive approach to improve your chances of success in overcoming dual diagnosis. Call us today to begin your journey to recovery. That's it for today. Please subscribe and hit the notification bell. Like, share and comment. We would love your feedback. Have a great day.